my name is Dr. David Park. On behalf of the RVU COVID-19 response team, I am providing you this informational update to give you a better understanding of what we know about this current pandemic. I'll also provide you a situational update on what our university is doing in handling this crisis. The coronavirus disease of 2019, called COVID-19 for short, is caused by a novel coronavirus. This means that it is a new virus that has never been seen before in the human race. The World Health Organization has named this virus SARS coronavirus 2, and it is this virus that is causing the disease COVID-19. SARS is an acronym that stands for Severe Acute Respiratory Syndrome, and it is appropriately named this way because people infected with this virus are getting severe difficulty breathing, coughing, and people are dying from respiratory complications such as pneumonia and respiratory failure. Now, you may have heard the COVID-19 being compared to the flu, and the reason we are taking this situation so seriously is because we believe that this novel coronavirus is much more harmful, it is much more fatal, and also much more easily transmissible than the influenza virus. This is why we are asking everyone to take extreme precautions to prevent this person-to-person spread. The global community, national, local, and our university, we have all asked and implemented measures to prevent this transmission. This is why it is so important to thoroughly wash your hands frequently, to disinfect objects that you touch frequently, and to not touch your face because it is possible that the virus is on your hand and can infect you through your eyes, your nose, and through your mouth. We know that this is caused by respiratory droplets, so if someone coughs or sneezes, this virus can linger in the air for minutes and potentially up to hours, and you can inhale this and then get the infection. We also know that this virus can live on surfaces for hours and potentially up to days, so that if you touch something, you can get infected. We are asking people to stay at home if you're sick. We are asking people to avoid close contact with people because we are trying to prevent our current healthcare system from being overwhelmed by patients with this illness. There is a capacity for current healthcare systems, and it's unfortunate, but there is an increasing number of healthcare providers on the front lines that are now getting exposed and infected with coronavirus, which means that they have to isolate themselves and self-quarantine, which ultimately decreases the healthcare workforce to take care of all the sick people in this country. So please do not go to the hospital unless you are very, very sick and need immediate medical attention. Now, the university has responded to this by having our response team meet on a daily basis now, and we are getting the most current updates from national and state health departments and implementing all the recommendations and guidelines to keep people safe. As of Dr. Adams' email yesterday, we are going to what's called a restricted access status, where only essential personnel who absolutely must be on campus will have access to the campus building starting Monday. We encouraged everybody to work from home, to telecommute, and we know that this has caused lots of inconveniences and frustrations in our employees and also our students. Please know that everyone at Rocky Vista is working very, very hard, many long hours, to make sure that our quality curriculum is delivered virtually and that our students are getting the necessary education that they need. Understand that Rocky Vista is not the only institution facing these challenges, that this is a national problem, and all medical students, PA students, and master's students are facing similar situations. At this time, we just ask that you remain very vigilant, remain very well informed, be extra precautious, and please be safe. We can and we will get through this together.